Today, let's talk about healthcare in general terms and why universal healthcare is not the same as free healthcare.
Welcome to YD. Why do Germans do things the way they do?
Where shall we start? Best to go back a long way, even before Hippocrates' humoral pathology. As early as the Stone Age, researchers found skeletons with healed fractures or even healed amputations, such as 31,000 years ago in Borneo. After breaking a leg or even amputating a foot, the patients had to be cared for and to fed for several weeks. Back then, there was no money or insurance. Why would anyone do such a thing? Presumably, the community felt it was important for others to survive. Nowadays, we would call it human or Christian charity, but back then it was probably just common sense or even human nature. We can therefore conclude that humans have been helping each other, including medically, ever since they have been able to do so. The first texts were written down in 3700 BC in ancient China by the ancient emperor Shennong, in Vedas of India around 1500 BC, or clay tablets in ancient Babylon, and in the writing of Hippocrates. What they all had in common was that they explained the world, for example, with the different temperaments. With plants, conclusions were often drawn about the internal effects from the external appearance, and then whatever had proven to be effective was used. Even though the four temperaments are scientifically nonsense and thus humoral pathology was based on false premise, the idea of a balanced diet made a lot of sense. During the Middle Ages, knowledge was written down and reproduced in monasteries, which is where knowledge of medicine, including from the Orient, came together. The most effective and important medicinal herbs were cultivated in the monasteries' herbs gardens. Later, universities emerged, which advanced in the training of doctors. Barbers, doctors, midwives, and surgeons were paid by patients, and towns also employed doctors to look after people's health. In monasteries, everyone was helped, often solely out of Christian charity. At that time, medicine were often made by the doctors or healers themselves. In modern times, it became more scientific, and today the roles of pharmacists and doctors are separate. Some make diagnoses and treat patients, while others manufacture or sell medicines. Monastic medicine gave the rise to hospitals, some of which are still run by the churches. I explained that here. But what about healthcare? I explained the nature and background of German social security system, which is probably the oldest in the world here. The United Kingdom took a different path with the National Health Service. So while Bismarck said that workers should believe that the German Empire was a welfare state, the United Kingdom became a welfare state. Unlike the contribution-based system in Germany, the NHS is financed directly from tax revenues. When I was in Lincoln for a semester and once went to the NHS clinic at the university for treatment, I didn't have to pay anything and wasn't asked about my insurance. The French healthcare system is said to be one of the best in the world. And throughout the EU, the state or statutory health insurance of another country is supposed to be accepted to cover treatment costs. But does that make sense? Providing medical treatment to people for little money? In Germany, there is currently another discussion about how expensive everything is. And because employers pay half of the contributions, non-wage labor costs are rising. Funny, because the Federal Statistical Office has just confirmed that Social Security contribution, which also include, for example, continued payment of wages in the event of illness for employers, have fallen by 1.5 percentage point from 19.2% in 1999 to 17.7 in 2024. During the same period, contributions for employees rose from 12.3% to 13.8%, an increase of 1.5 percentage points. The CDU-affiliated Wirtschaftsrat, Economic Council, recently proposed that dental costs should be removed from statutory insurance in future. Presumably, people have not understood how important good dental health is for humans. If people become ill due to poor dental health and this costs the health system even more, it is of course absurd. But the main thing is to make populist economic demands. But yes, if people work in health system regularly receive more money in line with inflation, medicines costs more and the population is aging, then health services costs more money. But back to the point of whether it makes sense at all to care about health for citizens. Survival of the fittest. The healthy will survive or live longer, and the others simply don't deserve any better. They could have earned more. One of the worst epidemics in human history was smallpox. It has been documented since the 9th century, but there are references to it in the Old Testament, and it probably existed 12,000 years ago. However, it has been eradicated since 1979 because the world's population has been vaccinated. I remember my uncle's smallpox scars on his upper arm. Admittedly, some of the vaccination campaigns were highly questionable by today's standards, and in some villages in the third world, people were virtually forced to be vaccinated, or at least not informed according to today's standards. But it worked. After 1978, there was no more outbreak of smallpox worldwide. Polio could also be almost eradicated, but in a few conflict regions, particularly in Afghanistan and Pakistan, the virus is still active and from there it occasionally spreads out to other parts of the world. Incidentally, polio was eradicated in the GDR before it was in West Germany. Europe was polio-free from 2002 until two cases reappeared in the Ukraine in 2015. It seems that the functioning health system is useful in ensuring that such diseases can be eradicated for good. But general preventive measures can also help with many other diseases such as cholera or dysentery, which are caused by poor hygiene or contaminated water. In the 19th century, scientists and physicians such as Louis Pasteur and Robert Koch, commissioned and funded by the state, searched the world for pathogens. Nowadays, researchers are sent to bat breeding grounds to find potential future pathogens at an early stage, preferably before they are transmitted to humans. The World Health Organization is active worldwide to help establish general health standards, particularly in poorer regions. And as we can see with polio, it makes sense to combat it in poorer countries too, because in a globalized world, pathogens can quickly be imported from abroad, as we saw with the COVID-19 pandemic. So it makes sense to promote general health. As we know from vaccinations, they not only protect those who are vaccinated, but also, if coverage is sufficient, the few who have not been vaccinated, because pathogens are unlikely to reach them. In many countries, vaccination rates are high because people understand that it makes sense and protects everyone. In some countries, there are also compulsory vaccinations for certain vaccinations or occupational groups. For example, Bavaria introduced the world's first compulsory vaccination against smallpox in 1807. How does a German doctor respond to the question of whether all children should be vaccinated? You only have to vaccinate the ones you want to keep. Incidentally, the Bundesverfassungsgericht, Federal Constitutional Court, has also confirmed that compulsory measles vaccination is constitutional, ruling that this minor encroachment on personal freedom is justified in the interest of protecting public health. But in reality, it makes more sense if people understand why health is important and why vaccinations can be part of it. It is actually inexplicable why people in civilized countries with appropriate schools suddenly decide against this and plunge into unscientific, sometimes esoteric abysses. What about the prices of medicine? Who sets them? First of all, the manufacturer, even in Germany. But it's a bit more complex than that, so I'll try to simplify it a little. When a new drug comes onto the market, it must immediately prove that it is better than any other product that came before. If it offers an advantage, the manufacturer and the statutory health insurance companies agree on a reimbursement amount that applies from the 7th month after the new drug is launched. Before that, the manufacturer can set the price itself. When the patent protection or a drug has expired and generic drugs are available, the market determines the price. Many statutory health insurance companies then want the cheapest drug with the same active ingredients to be chosen. This type of price coordination exists in most countries because it makes sense for the masses. In addition, there are fixed fees that wholesalers and pharmacies are allowed to add. Over-the-counter drugs are not usually subject to this procedure, and the manufacturers can set the prices themselves, but they are not reimbursed by the health insurance companies. The fees charged by doctors and dentists are also fixed. These are determined in consultation with the Bundesärztekammer, General Medical Association, insurers, and the Bundesgesundheitsministerium, Federal Ministry of Health, and are ultimately set by the ministry. Everything in the German healthcare system is therefore regulated. This also exists in other countries in a similar form. Some people even believe that no one should profit from people's health, and especially not when it is based on tax money or social security contributions. To clarify, of course, doctors and nursing staff should be paid and the costs incurred for medication and surgery should be reimbursed, but no profits should be paid out to any owners or shareholders. Let's put it this way, universal healthcare in Germany has proven its worth. And even though it provides care for everyone, it is of course not free as it's financed by contributions from the insured, or, as in the United Kingdom, by tax money. Incidentally, research into various basic principles is also financed by tax money at public universities. Often only further development in companies only begins once promising basic principles have been researched. So it is possible to operate universal healthcare systems that benefit everyone. But this only works if we work together socially. Those who don't want this because individualism or selfishness is more important must then choose a different system. This is likely to be more expensive because it is designed for profit. The desire to help others is so strong among various aid organizations that Médecins Sans Frontières deliberately travels to crisis and conflict zones to provide voluntary and unpaid assistance. Or Friedensdorf International near Oberhausen, which started as a citizens' initiative and enables thousands of children from all over the world to undergo life-saving operations and rehabilitations in Germany or locally every year. Remarks, additions, and comments in the comments. Thank you for your attention. See you in the next video.